Now let's move on to discuss the pelvic girdle. This is a connection between the lower extremity and the rest of the body. The pelvic girdle is made up of two hip bones, and it's depicted in this anterior view. Each hip bone is made up of three bones: the ilium, or the wing of the pelvis, the ischium, and the pubis. And the three portions of each hip bone are usually fused by the age of 25. The hip bone articulates with the femur of the lower extremity of the appendicular skeleton and the sacrum of the axial skeleton. Let's use this lateral view of the hip bone to describe its anatomy, beginning with the ilium and moving down the anterior aspect. The iliac crest leads to the anterior superior iliac spine, the anterior inferior iliac spine. The pubis portion of this bone contains a pubic tubercle, and the pubic ramus fuses with the ischium ramus. The ischium portion of this bone contains an ischial tuberosity and the ischial spine. There's also a posterior superior iliac spine on the posterior aspect of this bone, and a posterior inferior iliac spine, as well as the greater sciatic notch. The pubis, the ilium, and the ischium bone all contribute to the acetabulum, where the hip bone articulates with the femur. The acetabulum of each hip bone is on the lateral surface, and it articulates with the head of the femur to form the hip joint. The three bones that fuse to form the hip bone are, number 1, the ilium, and this is the largest of the hip bones, makes up the superior portion of the acetabulum. The ilium has a number of attachment points for muscles, tendons, and ligaments, and there are 3 gluteal lines that mark the attachment of the gluteal muscles that move the femur bone of the upper leg. The sciatic nerve passes through the greater sciatic notch into the lower limb. At the superior posterior margin of the acetabulum, the ilium bone fuses with the ischium bone. The iliac fossa helps support the abdominal organs and provides attachments for muscles. The ischium and pubis portions of the hip bone. The ischium fuses with the ilium bone at the superior posterior border of the acetabulum. The ischial spine projects towards the lesser sciatic notch. The ischial tuberosity forms the posterior lateral border, and they bear the body weight when sitting down. The ischial ramus ends at the anterior border where it fuses with the pubis bone. The pubis bone has a ramus that extends from the pubic tubercle to the fusion point with the ischial ramus. The pubis extends superiorly to the anterior margin of the acetabulum, where it's in contact with the ilium and ischium bones. The two pubis bones articulate with each other at the pubic symphysis, which is a pad of fibrous cartilage. Here's another clinical challenge exam question. Which part of the hip bone is labeled in the image below? Here are the possible answer choices. A, the pubic tubercle. B, the ramus. C, the ischium. D, the ischial spine. Or E, the ilium. Here's the answer to the question. This question tests your knowledge of the anatomy of the hip bone, including the 3 bones that eventually fuse to form the hip bone. The correct answer for this question was A, the pubic tubercle. The pelvis is made up of the 2 hip bones we just described and the sacrum and coccyx of the spinal column. The anterior portion of the pelvis is made up of the hip bones, and the posterior portion is made up of the sacrum and coccyx of the vertebral column. The sacrum is attached to the hip bones with ligaments which stabilize the pelvis. Anatomically, the pelvis can be divided into the greater or false pelvis, including the wings of the ilium bones, and it contains the organs in the inferior portion of the abdominal cavity, and the lesser or true pelvis, and this is made up from the pubic symphysis, the superior rami of the pube bones, and in the posterior by the sacrum and coccyx. Some of the differences in the female pelvis are an enlarged pelvic outlet, lesser curvature of the sacrum, and a broad, low pelvis.